Hi, I'm Kimberly Mills, a licensed Medicare agent with Senior Benefit Services. I specialize in helping people navigate Medicare, including those who qualify due to disability. I work with clients across Missouri and Kansas, along with their family members, caregivers, and legal guardians, to make sure they understand their options and feel supported. Medicare can be confusing, but you don't have to figure it out alone. You can qualify for Medicare in a couple of ways. Most people think of it as something you get at 65, but if you've been receiving Social Security Disability Insurance, SSDI, for 24 months, you're automatically enrolled, regardless of age. Medicare then becomes your primary health coverage. That's why we see so many folks under 65 who rely on it for their essential medical care. Medicare provides coverage for hospital stays, that's Part A, doctor visits and outpatient care, that's Part B, and prescription drugs, Part D. For people under 65 with disabilities, this often includes things like specialists, medical equipment, therapies, and preventative services. You also have options to add supplemental coverage or enroll in a Medicare Advantage plan, depending on your needs, income, and eligibility for other programs like Medicaid. If you're under 65 and on SSDI, you don't really get a choice. Medicare automatically becomes your primary insurance. Even if you also have Medicaid and don't enroll in a supplement or Medicare Advantage plan, Medicare still pays first. Medicaid then helps with costs like copays, coinsurance, and services Medicare doesn't cover. But there are still decisions to make, like whether to add a Part D drug plan or explore a special type of Medicare Advantage plan for dual eligibles. A licensed agent like me can walk you through what makes sense based on your medications, doctors, and other needs. Medicare can work alongside other coverage like Medicaid, employer insurance if you're working part-time or through a family member, or veterans benefits. Who pays first depends on what kind of insurance you have. In most disability cases, Medicare is going to pay first, and other coverage may pick up what's left. If you're helping someone navigate this, like a guardian or power of attorney, it's so important to understand how those pieces fit together to avoid any coverage gaps. If someone qualifies for both Medicare and Medicaid, they're considered dual eligible. Medicare pays first, then Medicaid can help with premiums, deductibles, and some services that Medicare doesn't cover, like long-term care or in-home support. There are also specific Medicare Advantage plans designed for people with both, which can include extra benefits like dental, vision, rides to appointments, or care coordination. These plans are often overlooked but can be incredibly helpful. If someone you care for is on Medicare, you still have choices. You can stay on original Medicare and add a prescription plan. You can explore Medicare Advantage plans that combine everything into one. You can qualify for programs that lower your costs, like extra help for drug coverage or Medicaid support. The best choice depends on an individual's needs, income, and existing supports. The most important thing is to work with someone who will ask the right question and guide you based on your specific needs. Okay, so this is a big one. You do not have to be 65 to get Medicare. If you've been on SSDI for 24 months, you'll be enrolled automatically. Certain medical conditions like ALS or end-stage renal disease can also qualify you immediately. I work with a lot of individuals and guardians who are surprised to find out that they or their loved ones already have Medicare and just need help understanding what that means and how to use it. If you're a caregiver, legal guardian, or just someone trying to make sense of all this, you're not alone. This is a complex system, but there are resources and people like me who can help walk you through it step by step. I schedule in-person, telephone, or video appointments. Whatever works for you will work for me.